think some of the dietitians are also here. So very good morning to all of you. First of all, I'd like to thank the organizers, especially to Dr. Neeta Deshpande, for giving me this opportunity to interact with all of you on a subject which I think is one of the most burgeoning topics. The topic on which we are going to debate today is how to rebuild the doctor-patient relationships, right? Because if you see this relationship, what it used to be, it has deteriorated over the years, and there are many factors for that. So we'll try to see that, and we will also try to explore the possibilities, what are the things what we can do from our side, by way of which we can improve this. Now, a little bit about myself, since we are interacting for the first time. Well, I come from pharma background, right? And just a minute. And I have done different roles in pharmaceuticals. I've got more than 36 years of experience. But for the last almost 10 years, I'm working as a trainer. I've been also conducting a lot of sessions. I've conducted 2 sessions in business schools, 2 sessions in NIITs. And of course, I've got a passion of conducting sessions with the doctors and paramedical staff. And I've conducted more than 75 sessions, so that's, I think, enough for me as far as I'm concerned. Now, coming back to the selection of this topic, let me share with you that a few days back I was chatting with some of the doctors, and I was telling them that, look, my son-in-law, who is a surgeon now, and he has started his practice. And I said, I'm always very anxious because he goes and does the operations in the rural areas also. And the type of atmosphere which is prevailing, suppose something goes wrong, God forbid, not that intentions are not there to do well. The type of atmosphere which is prevailing is pretty hostile. So then when I met Dr. Neeta some 4-5 months back, and I was sharing this thing. So this thought came to our mind that why don't we put in this forthcoming IDEC meeting this topic and seek the doctors and other people's opinion also as to what are the reasons and how we can actually circumvent this problem. The module of this whole workshop is also such that I'm not going to give any rocket science to you, because this is something which is of very general in nature and everybody has got points to contribute. So what we will do is we will also seek, we will try to do some group work by way of which you can also give your points. And then we will also try to find out what could be the solutions. In the end, I have got one psychometric beautiful test which will also tell you what's your basically behavioral style. Because what happens is, once you know your behavioral style and you know the other person's behavioral styles, and if you can match this behavioral style by slightly flexing your style, the chances of getting along are very well. Because you must have seen, if you meet a person for the first time, even if you have not talked, but sometimes it so happens that you are able to decide, this is the person with whom I can relate, this is the person with whom I cannot relate. And that's only because there are certain behaviors which you see in the person which you feel are going to be akin to mine. So this is one exercise also which we will do in the end. Right. Now, coming back to this doctor-patient relationship workshop, what I've coined this. What is happening recently, of course, everybody is aware what happened in Calcutta and its fallout in many parts of the countries. But this is not one-off case. I have been seeing now for the last almost 10 years. And when I was trying to think how I should flow this whole conversation, I went also down the memory lane some 50 years back when I was a small kid and I used to stay in Lucknow and Ganeshganj area. And there was one general practitioner, Dr. Tandon, I vividly remember that anyone, whosoever used to fall sick in our family, we always used to go to him, and that was the era of dispensing doctors. We used to give all those colored liquids which were very, obnoxious to drink, but then the compliance used to be 100%. And whatever he used to say, first thing, even if I have got fever, he will say, don't eat anything, have just milk and tea. And trust me, all those 3-4 days, we used to have only milk and tea, no other food. But compared to what it used to be and compared to what it is now, anything and everything, whatever doctor is going to suggest, people think whether it is really required or whether there are some other safer methods, so on and so forth. Basically what I'm trying to highlight is there's a huge amount of trust deficit which has cropped up now in this, and that needs to be addressed, because the doctor-patient relationship, it's a very biased relationship, and we need this type of relationship simply because this relationship is good for the society. I also want you to ponder for a moment, what happens in a doctor-patient relationship? The patients come to the doctor and doctor has treated him. Is this somewhat similar to a vendor-customer relationship? Think about it. Now, what happens in a vendor-customer relationship? I'm a customer, I want to purchase a car. So, I will decide what is the cost of the car, what should be the budget. I will decide what should be the specification of those cars, what are the features I want in the car. With all this, I will go to the vendor and I will express that, look, this is the type of car what I want, and the vendor will provide. Now, in this interaction, the entire knowledge is with the customer. But think about it, when a patient is coming to the doctor, that situation doesn't exist. Patient has got some symptoms based on which he has gone to the doctor. Now the entire knowledge about the doctor lies with the knowledge about the disease lies with the doctor, not with the patient. So therefore it becomes also incumbent upon doctors also to guide these patients very correctly. Now the dilemma is, if you tell the truth, sometimes the compliance, as I was sharing with her, sometimes the compliance is not there. And especially this problem becomes much more acute in chronic diseases, because here any amount of DPP-4 inhibitors, SGLT2s and Lantuses of the world you may give, but if I am not adhering to diet, if I am not adhering to say exercise regime, my treatment outcomes are not going to be successful. And this is the difference between an acute care physician and a chronic care physician. Acute care, the patients lie in ICU. He only wants I should come out, attenders want my patient should come out of the ICU. So they are okay then. But when it comes to chronic diseases where the patient is ambulatory, the problems becomes much more acute. And gone are those days when you can force things onto the people. You have to have a persuasive skills. And unfortunately, this is what I have been, whenever I am conducting, I have conducted 2 sessions, 1 full day workshops in medical colleges, and I always maintain that the problem in our system is doctors, they learn a lot, MBBS, MD, GMs, but there's no system where which they are being imparted some soft skills, because they are not dealing with machines. Unlike an engineer, they are dealing with human emotions. Now I have got best of the best knowledge, but if I do not know little bit smaller things, how to deal with the person, then the treatment outcomes are not going to be successful. And whole problems are arising because of this. If you see all these instances which are happening, they are happening mostly, you will notice, with the junior doctors, those who have just come out of the institutions. Now they learn all these things over the years with experience. But if there is some system by which the basic things are being told to them, maybe their interactions will be much better. So it's not a vendor-customer relationship, it's a very biased relationship. That's the point which I want to say. Now, somebody may say, is the relationship required? Well, the relationship is very much required, because if this relationship is there, then ultimately what will happen is the treatment outcomes are going to be much better, and ultimately the society is going to benefit immensely. There are many other advantages also why this relationship is very important. If as a patient, I'm saying, if I'm going to a doctor as a patient and I have got full confidence, I am going to tell you something which may be sounding some impending danger, and I'll give examples. Suppose I'm going to a doctor and I tell that, look doctor, these days something is happening, that in the morning when I'm having my bed tea, suddenly my cup falls down, and then I regain the consciousness. Now it may be a sign of TIAs, impending signs, and all these type of smaller things the person is going to tell only when he has got the confidence in the doctor. Otherwise these smaller things may not come, and ultimately the major problem which he might encounter later may go unnoticed. So that is why this relationship is very important. Other things are like, it also improves the willingness on the part of the patients to engage with the doctors. I mean, the trust is very much there. Another thing is that obviously the compliance is much better, and again I will insist that in chronic diseases it becomes all the more important. And lastly, obviously we all want that our patients must remain with the doctors, and I mean I can tell you that I have seen many centers where patients have been coming for the last almost 10 to 15 years, and they are one of the best advocates to those centers, mainly because they have got the trust with those centers, and they feel that obviously their problems are addressed very well. Now, having said that, if you see the doctor-patient relationship, it is guided by 4x4 factors. I mean, everybody will agree that trust is very much important. Can anybody say that trust is not required? We all require trusting relationships. And as I say that most of the problems which are nowadays happening, they are happening only because the trust deficit is there. Secondly, knowledge. Why I say knowledge? Because, if you see, I would say 15 years, 20 years back, or when I started my career, say 36 years back, I mean, there were few diseases which we knew. HIV was not existing. The complex, the NASH and NAFLD, especially these days in diabetics, I mean, the way it's happening, perhaps were not there so much. There are so many other concomitant problems which are cropping up. So, in terms of knowledge, the more and more knowledge a doctor is able to acquire, it's going to be helpful for them. So, that's also important in order to have a very nice relationship. Regard, obviously everybody regards. Even as a patient, I want that I must be respected, and same is the case with the doctors also. And to sum it up, what I am referring is the loyalty from both the sides. I mean, as a patient, I should be loyal to the doctor. Doctor also wants the patient should be loyal. That if he's got some issues, he must tell me rather than running to some other place. But what currently is happening, there's a time constraint. I mean, I know that most of the doctors in India, they see somewhere nothing short of 30-40 patients. Am I right, sir? I mean, last year I was in US, some little issue, so we went to one hospital and I was just chatting with the doctor. She said, hardly I see 10 patients in a day. And then she was inquiring, what's the state in India? I said, India, it's very bad, sir. Our doctors, they see, I mean, some centers 50, 60, 70 patients. He said, how do you do that? How much time do you devote? I said, don't ask me that. Because it is humanly not possible to devote some 10-15 minutes per patient. Think about it. I mean, 40 patients, every if you want to spend 10 minutes at 400 minutes, 7-8 hours, then you have got patients admitted in different parts of the city. You have to go and see them. So there is the time. Time constraint is one of the biggest problems. Second is the space. Now when I say space, don't think about corporate hospitals. Think about ESI hospital. Think about those government hospitals where the doctor is sitting and is surrounded by 30 patients. Do you think he is in a position to take any history of the patient? I mean, he is forced to work in a very mechanical way. 100 patients, these are the doctors they are seeing. And there is a big problem there. Physician burnout is bound to be. I mean, I know most of the doctors, they start their day at 7 o'clock and they end up at 10, 11. So how long? You can do it 1 day, 2 days, 3 days, but when it comes even on Sunday that you have to go and see the patients, burnout is bound to be there. Language barrier is also one of the thing which is coming, because now patients have started coming from far-flung areas. So I mean, if the patient's coming from Calcutta to say in Bangalore in Karnataka, I mean, the language barrier also sometimes. So all these things, they put enormous amount of pressure on this 4x4 factor, by way of which we can have excellent rapport and relationship with the doctors. So this is one. Also, having said that, I must admit that the situation is changing. It is not what it used to be, say, 40, 50 years back. As I have just now mentioned, that the illnesses are becoming more and more complex. I mean, there are so many concomitant problems are there. Now, the fallout of this is, unlike those eras when I was a small kid where only general practitioners used to be there and hardly I will find any physician, DM was unheard. I don't remember, when I came in the profession, then only I started seeing DMs. And I know that in entire Uttar Pradesh there was one DM endocrinology, and that was Dr. He was in Aligarh Muslim University. The only DM in that entire northern India. So ultimately what is happening is there is an increase in the specialist practice. Now nothing wrong with this. Because when there is an increase in the specialist practice, it is with an aim to provide the better treatment to the patient. So if a patient has gone to say diabetologist, and a diabetologist feels that this person might be having some microaneurysm because of the long-standing diabetes, and he sends this patient to an ophthalmologist, or his serum creatinine is around 2.4 and he doesn't want to repeat, he says, please go and meet a nephrologist. It is with an aim so that he can get the best medication. But think about as a patient, I have gone to you, you send me to another doctor, that doctor tells me to go to another doctor, I am quite bewildered, I am not very happy. Though the intentions are pious, but still I feel that, look, what's happening, why should I go to so many places? It's possible that at the end of the day nothing comes up, that he is normal. But the intentions were that we want to give the best possible treatment. That's why healthcare teams are there in most of the cases. It is good and bad both. I mean, good from the patient, doctors want that patients must get the best treatment, but unfortunately that from patient's point of view, it's not very, they don't feel good about it. Not only because they have to go to different places sometimes, if it's not in the same corporate hospital, but sometimes they have to shell out more money also. I think I cannot elaborate more on this. I mean, patient's expectations, I'm a patient, and I can tell you, with this era of internet, I get thoroughly confused, because if I get detected as a diabetes, I'm in a state of shock first, then I go to the net, I try to find out what all I can do, what all I cannot do, and especially when it comes to diets, all sorts of diets will be prescribed. I am a very confused person. Now when in this confused state of mind I come to a doctor, I have got hundreds of questions which I want clarification. And you will notice only those centers who are equipped, like they have got a counselor, they have got a dietitian. They, I would say, serve as a buffer. Because I have got so many questions, I want answers, at least I am getting some answers from them. And then I go to the main doctor. But think about those doctors who do not have this infrastructure, what happens to them? Patient wants 20-25 minutes, as I have said, time constraint is one big factor. He doesn't have time, so ultimately what happens, this interaction, when the patient comes out, he is not very happy. This is what's happening. Blame and complaint culture. I think media has got a big role to play. And I would like to give you an example, like for instance, what happened, I think 1.5 years back in Gurgaon, where Fortis Hospital, they claimed some 17-18 lakhs from some patient, and it was blown out of proportion, as if all the corporate hospitals are doing this. And I was very recently, 2 days back, I was reading one article from Chetan Bhagat, and very aptly he has written that, look, why are you blaming doctors for earning more money, which is the profession where earning money is considered to be bad. So very nicely he has written. So ultimately what is happening, something goes bad somewhere, it is blown out of proportion as if everything is bad, which is not the case. And especially when you are dealing with sick people, like this person who was 75-year-old, I think more than that in Calcutta, who died. These are the things which are bound to happen. And I personally feel the public by and large should be educated, and we need such type of advocates like Chetan Bhagat and those people who have got voice to tell the people that, look, this is how it should be dealt. Litigations, very common. In foreign countries it's much more, because that's the reason they follow all the guidelines, because in case of any litigation it saves them. But litigations are happening nowadays, and resource limitation. One of the factors which is causing this problem is that the government infrastructure is very inadequate, and therefore there is too much pressure on the doctors. Insurance. Now, I feel insurance also creates a lot of confusion between the doctor and the patient. The doctor suggested some ultrasonography based on the requirement, and the insurance doctors, they do not approve that. Now as a patient, think about it. I will straight away start thinking, was it right on the part of the doctor to suggest that? Because this insurance doctor, he is not approving this. So it's creating confusion. And insurance, in fact, these days have started dictating the treatment. I mean, it is 100% in Europe, in America, because everybody, all the expenses are being borne by them. So they are dictating the terms, what should be prescribed, what should not be prescribed. Slowly and steadily, that thing is also coming in countries like India. So with this, I take a pause, and I would like you to help me. The help is, before coming here, I also interacted with some of my son-in-law's friends, those who are doctors. And I said, look, I'm going to conduct this, and I want some, points from your side also. And as a patient also, I will suggest some points. What are the reasons you feel why this relationship is deteriorating? So what I'll earnestly request you is, maybe, you can consult, and this side, or rather, I'll request one person to come and assist here, because there are, 7 persons here, maybe one. Maybe you can suggest points from patient's point of view. Patient's point of view. What do you think as a patient? What are the reasons why these relationships are deteriorating? You can think about, say, from doctor side. Is there any doctor? So you can think about doctor side. What do you think are the factors contributing towards this? How much time do you think will be required? 5-10 minutes? 10 minutes is good enough? So this is the, everybody has? Yeah. So you need to consult. So you need to also give points to them. So that's why I wanted a round table, but then it was not possible. So maybe, ma'am, can you come here? Whatever points comes to your mind. I have also jotted down some points, so we will mix and match.
You are able to fulfill my expectation. उनका expectation ये होता है कि पहले उनका भी सुनो, उनके डॉक्टर का भी सुनो, उसके भाई का भी सुनो, सबका सुनो. Difference.
Patient there.
You are very small. Where? I don't saw that.
Soft skills are more required.
Our problems are taking responsibility and not giving this. Most of the time they don't understand. At the time of emergency.
So you are representing as a patient side. So you have to tell.
I'm telling both sides actually.
Yeah,
so both doctor side they are doing it. Think about patient side. What as a patient you feel why doctors are responsible for breakdown of this relation?
And they expect more.
So that again will come expectations are like high.
So you can club it like those points which can come under one heading. That will be better.
Our doctors also are taking it about all these facts and all that. This is one. Another is insurance, health insurance. Because of unemployment, there is no health insurance.
Now insurance come that many NPO have schemes are came, so everybody wants to treat it.
Aware of it.
I want aware of this.
They are not mentally prepared.
From doctor's side, I would say,
So
in Metro City, if
they don't want to pay for hospital.
appendicectomy,
Good.
positivism, or carotid aspirate will cost only 1 lakh.
Patient, I want to blame doctors. Right? Doctors are doing this, doctors are doing that.
We're doing the opposite side, which is absolutely true from your perspective. But what we should do is we should look at the opposite side. Your patient side.
I'm not in the wrong group. I'm just as a
You have put on different.
Whatever she's calling is free. Even yeah. So example from a diet, we don't have it for 3 months, probably have a monthly follow-up, some diet follow-up, weekly follow-up. They're calling to frequently once a week.
Prior to that, so Query for बताता हूँ आपको वैसा.
Medicine का side effect, like I see when like example, it is not written. So they again opinion is told.
Not explained.
Right.
Person for the group.
What's your name?
And
Sanskrit. Uncle will speak.
so I will try to jot out. Only thing is, if there are some common points, we will avoid, right? And then I will show you what the exercise what we had done. Okay, so this is patient side, is it? So what are your major points? If there are some common points, you can club it under one heading.
Yeah. So time constraint or a restraint.
So you feel that doctors are not giving time,
Proper.
enough time. They are always in a hurry. Okay?
Doctor's attitude, so they could be arrogant. Or they're
Arrogant
not looking
attitude.
in your eye. Just
They are
like
not friendly.
Yeah, they're not very friendly.
Okay? Very nice word. Somebody said
And
empathetic.
they're not empathetic.
Non-empathetic. Okay? Then
Too many investigations recommended.
too many investigations.
Referrals.
From a patient's perspective, what is the reason for it? Why do we need it?
Good. Fine. So why need it? Fine. Then
So if you go for a follow-up and it's like continued the same as what we were doing earlier, so the treatment plan is absolutely the same, why did he charge so much? So follow-up charges not probably,
Follow-up time also.
so doctors are forced to change the brands. है ना? Same sitagliptin, different brand. Right.
city all.
Yes.
What to do?
The next one is basically patient counseling or patient education. They don't do that. So example, if we have to shift from let's say diabetic medication to a insulin and it's a required from a doctor's perspective, they don't explain it well in a layman's language to a patient for us to be convinced.
You know, something to do with. Oh, fine.
Yeah.
It's a separate point.
Yeah.
It's a definitely separate point. Yeah.
So basically we have a lot of information as a patient thanks to social media and Google and we're like no, it's not concurrent to what he's saying.
So I would say, can I put it this way? Misinformation
Right.
through social media.
Yeah.
Google Doctor.
Misinformation, Google. Okay.
The next one is they're probably writing a lot of things to be like worked around. So a lot of medications. And then it might not also seem very practical. So that's
Too
from a
many
doctor's
medications.
perspective, imagine too many medications. From a dietitian perspective that she's giving so much to cook, or there's so much to think, or there's so much to do. So not very practical approach maybe.
Yeah, which is not practically applicable.
Okay. Okay. Then
Side effects or complications not very well explained.
Side effect, course of disease, complications, not explained.
ये नहीं किया then okay probably my vision is going to be affected. Why didn't he tell me earlier? I would have taken it more seriously. So again I think a lot to do with time constraint and counseling. The
so
same point.
can we club it some of the points?
Yeah, yeah.
Time constraint is one. I would say, can we put it this way?
Yeah.
This is also something to
Therefore,
do with that.
communication and counseling.
And complications not told, not that the doctors they don't want, but then arrogant, can I put it as attitude? Hmm?
Yeah.
So I'll put it in a different color. Too many investigations, why needed? Okay, follow-up charges, separate point. Misinformation, Google, fine. Too many medications, fine.
Also we can probably add one more point just like came through. Basically not available. Like I know a lot of doctors, I'm talking about Bombay per se.
When they want it, the doctor is not there.
That and also
Phone.
people also phone, yeah, WhatsApp. There are a lot of them who are available, some of them who are not. So example, if I'm talking from a gynecologist perspective, I would really want to recommend a available doctor. Because like I could probably get some problem at 12 o'clock in the night and I would want availability. So I think again between time constraint and availability, but I'm talking about also non-physical availability. So from the phone perspective or an email perspective.
Okay. Approachability.
Approachable,
Yes.
right? Yeah, right.
Alright. Great, so thank you very much. So what about the next group? So this is doctor side, is it?
Yeah.
Fine.
So the first point is that sometimes in medical care there are too many patients' relatives involved. For example, that one day of on the day of admission in the hospital or the first time of a consultation, there's one relative along with the patient, and you explain everything. But then the following day or during discharge, there's another relative, and they have different ideas, and you need to go through the same process again with them. So too many people involved, it gets too complicated, and the doctor suffers in the bargain.
Fine. So too many attenders,
Yes.
right? Can I put it this way?
Some
Or different attenders?
Some single person should take responsibility. And
Absolutely.
he should inform whatever information doctor has given to
So
him.
primary
He should
caregiver.
give to others also. So every time if new relative comes, it is not possible for doctor to explain. Same thing
So we are
again
looking
and
at the
again.
time
One's
constraint.
understanding is also different.
I completely agree what you're saying. So I would say too many different attenders. Can I put it this way? Too many different attenders. And you need to explain them completely to them. Okay.
Okay, next point would be misinterpretation of the advice that is given.
Hmm.
So sometimes a doctor does not mean something in the fashion that it is taken by the patient. They kind of misinterpret what they are trying to say, and they get defensive, or they
Communication
get
gap.
You can say a communication gap. It's also like I mean something, but then I look at your body language changing, and you misinterpret what I'm trying to say. So that's also a barrier between me trying to help you.
So can I put it?
Patients don't come with a learning attitude.
I will
Basically.
put it in different way. Because whatever points we are telling, most of the time in the medical terminology comes in. But the person sitting
It doesn't
opposite
understand.
side, they are not aware of the medical sides and all that. This is one thing. The second point, what put out, doctors are not, one thing, they are making too many investigations.
That is coming. So coming back to again rephrase that.
So I would say that
How will you rephrase? So I'm getting your point. What you're trying to say that look, I start telling you that look, your perhaps say serum albumin is serum creatinine is say 2.4, and maybe it will be a good idea that you consult some nephrologist. And then I see that there's a lot of resistance from that, so I leave it as such.
or the patient would say that, are you trying to say that I have a kidney problem now when I've come to you with this sugar
Basically,
problem or something?
lack of knowledge leading to misunderstandings.
Yeah, that is better. I think.
I want to just give a little live example of what just happened 2 days back when I was consulting. I'm a nutritionist by profession, so I'm going to give you that example obviously. So coming back, so this is this Guju auntie who came to me, and I obviously understood her culture. How I go about it is like get the entire protocol and then like call her again and give her a very detailed diet plan. There were not too many, that's what I thought, and I know so as well. Not too many, but she was very close from her head. So when she started on me and for such a beautiful detailed plan that she was like, okay, I can't do this. She'd been saying in the first visit as well. So I just lost the motivation to even try to persuade her. I was like, okay, fine, I'm going to leave it on you now.
So
And I've never
mindset.
done that. And I thought I've changed as a person because I'm doing that. So I really feel lack of motivation from a doctor because you see that vibe and you see that complete negativity towards wanting to change. Even a percent of change.
Even
From that
mindset
perspective.
of the patient.
So stubborn attitude. Can
Yeah,
I put it
probably.
this way?
Yeah.
No? Okay.
The most important thing is not only stubborn attitude, but it's the resistance to
Yeah,
change.
so I think
The
mindset.
nutritionist is trying a level best, मेरे से होगा ही नहीं, that's the way it started. तो उसका mind is all, they have mental blocks basically.
Negative.
So I will share with you some case studies I have prepared, which exactly are like this only. That look, you have told everything,
Yeah.
and the patient says this is not possible for me. And then as a clinician, I am completely at a loss what to do then, because if I tell if you are not going to do this, I am sorry, I may give you best of the best medication. I may put you on 50 units of insulin, still blood sugars are not going to be under 7 HbA1c. If I tell this, he is going to run to some other place. I mean, unfortunately, that's the dilemma. If I tell you the truth, you want to go to do shopping elsewhere. If I don't tell you, then you suffer. Sometimes, okay, fine, you suffer. I mean, it's entirely up to you.
This is because of she's not knowing the consequences.
Exactly.
By
So
what-
every behavior,
by
so
not
you
doing
absolutely, you have hit the nail on the head. As long as I know the consequences of my behavior, right, the compliance will not take place. I mean, I say in corporate world, sometimes when people don't, adhere to certain things, we only tell them the same. Fine, it's absolutely up to you.
The other side of it is, if you tell them very seriously, it is, you have got renal failure to start now. She assumes that tomorrow I am going to die.
End of the
So
insulin में भी होता है ना. The moment you put insulin,
mentality of the patient also has to be
so
maintained by the
it has something to
That's why
do.
this problem
It has
comes.
something to do also with the knowledge, the correct knowledge. I am saying correct knowledge is very important, because knowledge, everybody tries to go and seek from the internet. But the correct knowledge, sometimes people don't have. Yeah, other points.
Alright, next would be the monetary issues of the patient. So first is they are not open to referrals if you feel that they need to be referred to another specialist, which
Yeah.
is not your specialty.
Okay.
Second would be if you require additional amounts of tests. So for example, a patient comes to you, says they have a lot of fatigue. Now fatigue can be in so many different cases. The cause of fatigue could be many array of conditions, but you would not know until you investigate further. Right, so that sort of thing. The third is they have expected outcomes that they set in their mind and they come. It's either a high expectation from a short period of time, or that they expect free treatment and are unwilling to pay for whatever is required.
Okay.
So
So
those
best
would
of
be
the best
monetary
treatment with
issues.
least cost.
Yes.
Huh?
And that leads to non-compliance again. So
Best treatment, least cost.
What madam has told is very correct. It is fatigueness. This can be having
So
all investigations may be normal, or she may come out to be some malignancy or something like that. So for confirming this, we have to go through this all.
Sir, her example,
This is-
it happened to me. Once I was driving car and I tripped
If it
for a
is not
second, right? I tripped for a second, and God has saved. I hit a boy. He had a fall. I had to take him to Fortis, got all the investigation done. Immediately next day I went to Dr. Hari Narayana, endocrinologist in Bangalore. He said, sir, this is what has happened. I'm really worried. Please, I suspected some TIA type of thing might have happened. Then he said, get your vitamin D test. And I realized that my vitamin D was very, very low. He said, this is the root cause. Take cholecalciferol and things like that. And I was okay. So you are absolutely right. Many times it's so vague that you can think in different directions. And if you want to come to the conclusion, you have to go for the test. You are absolutely right. Which sometimes patients, those knowledgeable persons will do. But sometimes those who have got obscure, thoughts about the doctors may say, why I am being subjected to so many tests. Yes, next.
next would be lack of adherence to treatment. So even from a doctor's perspective, if I suggest a particular treatment to you, maybe you're motivated for the first a week or so, and then you leave the course of treatment and you come back to stage 1.
It happens, yeah.
Next would be
Sustenance of motivation is very important.
yes, and next would be like the priority of the line of treatment or the outcome. So what a patient expects and what you as a doctor expect are different. So for you, a medical priority would be different, and what patient wants to see would be more visible. If I look at a dietitian's perspective, my first priority will not be to get them to lose 7 kgs or 8 kgs. It would be to see that all of their medical parameters are kept in mind, they are at a good health, and then they get weight loss as a byproduct. So something like that, or even in the case of doctors, when they want to look at one symptom which is more critical as compared to the other symptoms. So there's a clash there.
Fine, so
Unrealistic.
different perspectives.
Priority and
Priority, I would say priority, difference in priorities.
Okay,
Priorities of all
Right.
jobs, basically.
Priority clashes.
Or different goals in.
okay.
Next would be in the case of emergency conditions for the doctors, that because you have to go and seek the relative's opinion on what needs to be done in an emergency situation, and there's no fast decisions made. They think a lot, they think what is the best case scenario, they're not willing to sign the forms and all of that. Yeah, so the cooperation is a little low and time is lost in the bargain in emergency situations.
Nice. So doctors are not able to attend in emergency situations.
No, doctors no. The patient does not,
Patient
relatives don't make fast decisions during
patient or-
emergency situations.
Okay. Fast decisions
And then loss of time.
not made. Right? By relatives. Any other point?
The next I think might overlap. It was a point with regards to like as no trust in the doctor. So first would be like with regards to, I give an example of as a dietitian, if I want to prescribe like a adequate protein requirement for a vegetarian, and I take the record of the patient and it is extremely poor.
Yeah.
So I would need to suggest to them a nutritional supplement from which they would be able to get that much of protein. But if they are not willing to understand the importance of that, then I'm not able to help them out. So I think it would overlap with one of
Again,
the
trust.
points.
It's basically, I mean, there are many points which are indicative of trust deficit.
Yeah.
Now, if the trust is there, there are many points like priority of goals.
Yeah.
It has something to do with trust deficit, right?
Yes.
So this is one. Or decisions not made fast. Why? They are deliberating. They are deliberating because they don't have that sort of trust in the doctor. Otherwise, if the doctor is told this is to be done, immediately people, why is it so in acute care you immediately sign? Because there you don't debate. Because you find, you know that if immediately the treatment is not getting started, the patient can go into serious problem. But in ambulatory situation, people start. So it has also something to do with the trust deficits.
So I
So
think another point which covers that is that they take a second and third opinion if they don't get what they want.
yeah,
Trust
that is,
deficit.
yeah. So I mean,
It's trust.
Yeah.
it's also trust. So I mean, if you take this point, if you take this point, if you take this point, priority of goals, lack of adherence. Why is it so lack of adherence? I mean, as sir was saying, if I know the consequences of my behavior, if I know that look, if I am going to consume enough amount of protein, when my serum creatinine is 2.4, very shortly I am going to land up with CKD, and you take him to a dialysis center and tell, look, this is what happens to you. I am telling you personally, I am a diabetic. Any day I would love to die due to heart attack rather than due to CKD. Right? Because I have been dealing with all these patients and I know every third day you are there for 4 hours and that pungent smell which is there in that dialysis center, I mean, I can't even withstand that. Are you getting? So once I know the consequences of that, adherence comes. Because then you are always thinking about it. If you do not know the consequences, sometimes people take it too lightly. So again, it has something to do with trust deficit. Otherwise, people immediately they will adhere to that.
Excuse me, sir. Excuse me. The trust adherence trust absent होना, that is only because of the misconceptions they are spread in the society through media and all that. Untoward incidences, they are giving a lot of publicity, and that is pointing to.
So I think you came later. Media intervention.
100 good cases they won't be published, but one bad incident is getting so much publicity that every single
Sir, you are absolutely right.
ordinary citizen is scared of all these things.
Absolutely right.
He believes that these are the true stories of the medical
That is true.
That has created the main
So
problem.
media has got a lot of role to play.
That
Media has got a lot of role to play, and they try to sensationalize, the things. So in order to create that sensation, they are always on the lookout for such type of things.
So it is TRP, sir.
So unfortunately, that is what is happening. So what I'll do is, I'll take a picture of that.
And the comments they pass on it, they are very funny. I
So,
mean,
comments, yeah.
I will just tell you, in Bhutan, the doctors and teachers, they are paid highly.
Highest.
Because that country believes that doctors and teachers are the backbone of our society. And whatever our media was saying, भूटान में ऐसा हुआ, लेकिन भारत में अगर डॉक्टर और टीचरों ने उनका स्ट्राइक भी बंद कर दिए, that will be beneficial for the country.
I agree.
They should only stop strikes and all this. So this also pinches to the people.
So now, before I move on to the next component of this, where I will seek your solutions.
Yeah.
Okay, so what I'll do, I did this exercise also with my doctor colleagues and friends. And these were some of the points which came from patient side. So, arrogant patient, somebody has said arrogant patient? Arrogant.
This is from doctors.
Patients factors, reasons for breakdown of doctor-patient,
From
patients factors, where patients are
Yeah,
responsible.
patients.
Where patients are responsible, right? So arrogant patients, it has come. Now, we have to see why arrogance is coming. One reason is social media. One reason.
It's other way around. Here, patients are feeling that doctors are.
What they said was that,
Patients
the
factors.
doctor,
Patients factors means doctors
Doctors
are telling that patients are responsible. So arrogant patients are coming, as you are very rightly
Yeah.
said. Family members not appreciating the issue. It has also come about,
Yes.
right? Best treatment with least cost,
They said.
that also came about. Media intervention also came about. Patients' expectation of time, that also came about. Lack of government infrastructure. It has not come, but then people said that,
That is one of the major reasons.
why? Because unfortunately government is not able to help it. And then the entire pressure comes on to the private doctors, right? Trust deficit also has come about. So we are almost in sync, with all of you, what you are. Internet leading to inadequate knowledge. Now, is there anything which has not come here?
That's the back one.
Which one?
You're looking at the one in the back.
no, not the one. The one that you.
This one I should see now.
Yeah.
So, is there anything,
Priority of goals, I think, is but trust. Yeah,
priority of goal is also part of trust deficits only. Because trust, I want to dwell on this, how we can restore the trust, how we can have a trusting relationships, right? And that's very important. So, that will cover up many things, many problems.
Whatever the reasons are, so that soft skill training, when I'm attending that is, where is the lack, because पेशेंट आने नहीं मुझे उनके पास ही जाने के इनके पास नहीं जाने का वो कुछ समझाती नहीं है वो पता है घंटे वो पता है and then it saves my time but then that first time when it comes I have to repeat whatever she has said that is like a reinforcement बाद में the patient will not go I mean this is what I do
True.
and fortunately I am successful in most of the time.
Sure. You were saying something?
Yeah, so just to answer this question correctly right now, according to my opinion, I'll just tell them that basically HbA1c is a parameter which changes every 3 months. So these are all reports, I need to know what has happened. Let's just rule it out. Let's only one line, let's rule it out and अच्छा तो great bonus हो गया.
Education.
Yeah,
So if I
let's
say,
quickly
can't
just
create
say what the
conversations
reason
of-
is.
If I pick up
6
your
months
point,
back report.
if I pick up your point, what we are all talking is,
Education.
as a patient, the person must be told that diabetes is a progressive disease. Every 6 months or 1 year, you have to undertake all these tests so that we are pretty clear about it, how your different organs are functioning. So, this is an ongoing process, right?
And all will not be required to be done.
All will not be required, but whatever is required, like kidney function test once in a year is a must, for instance, as per American, Kidney Federation. So all these things are there. So fine. So education is coming as a first point, right? Second, okay,